Guys, welcome back to the Book of Perfusion by Jaz Hidayat. So, Daddy, hello, how are you?
I'm good, beta. Welcome back to the Book of Perfume by Ijazat. Yes, Shinza, Ijaz.
Yes, Daddy. So, we have a question today. So, the
Hmm.
question is that how to manage the fibrinogen level during the cardiac surgery, especially in the pediatric cases.
Especially in the pediatrics,
Yep,
fibrinogen level.
fibrinogen levels. Yeah.
The fibrinogen level play a very important role to manage the hemostasis,
Okay.
especially in a pediatric surgery. So we should know the baseline of the fibrinogen level. So how you know the baseline of the fibrinogen level? So there is two machines available, like a rotam and the tag machine. With the help of the tag or rotam, the one which is available in your centers, you can do the baseline fibrinogen level test, or you can send your lab report to the main lab and they will give you the results of the uh, fibrinogen level. So ideally the fibrinogen level is around 200 to 400 milligram per deciliter. Okay.
Okay.
And our target as a perfusionist during the cardiopulmonary bypass, especially in a pediatric surgery, to maintain a fibrinogen level above than 150 or around a 200 to 400 milligram per deciliter, which will going to help to avoid coagulation and bleeding. So it is helping in this matter of like hemostasis, and this is helping to avoid massive bleeding. So this is the base. Once you do the baseline, even the facilities available during even the cardiopulmonary bypass, and you can check the fibrinogen level of the patients. And usually in adult surgery, we didn't require a fibrinogen level test or to do the fibrinogen level, or the dilution of the our circuit is less as compared for the pediatric surgery, because the intravascular volume for the adult cases you have around 4 to 5 liter intravascular volume, and your ECMO your cardiopulmonary bypass circuit priming volume is around like a 1 liter. So it will not make a such difference in clotting factors. The time of you diluted your intravascular volume with the crystallite, the circuit you already primed for the cardiopulmonary bypass, as compared with the pediatric surgery, there is a chance of massive dilution with the crystallite, and which can going to decrease, drop the fibrinogen level and the rest of the blood factors, clotting factor, to be diluted, and the concentration will going to be diluted, and there is chance of the coagulopathy. To avoid all these type of scenarios, so in the beginning, as a perfusionist, you monitor the baseline hemoglobin hematocrit of the patients. You do the formula that you required, like 25 to 30% hematocrit on pump, and for that you do the blood transfusion in your priming, and you added the fibrinogen factors, like you can use a whole blood in your priming instead of the PRBCs. And as I mentioned before, you can do the uh, fibrinogen level test with the tag machine or with the rotam machines. And even you can continue to check during the cardiopulmonary bypass, and try to keep it the fibrinogen level around above than 200 milligram per deciliter. And if it is below than 200 milligram per deciliter, there is a chance of the black coagulopathy. And for that you can give a cryoprecipitate is the ideal to give to the patient to minimize and to increase the fibrinogen level. And it is almost like a 1 to 2 unit per kilograms. People they are giving the cryoprecipitate to manage the fibrinogen level of the patients. As a perfusionist, we can do the blood conservation technique, and with the blood conservation technique you can do the wrap. So try to keep the normal physiology of the patient and avoid dilutions. And for that we can do the wrap retrograde autologous priming of the patients. We can give like antifibrinolytic drugs like tranexamic acid uh, to avoid fibrinolysis of the blood. So this can help to keep the fibrinogen level in activate level. Post-op, if you notice there is a massive bleeding, then you have to give like a blood clotting factors like a cryoprecipitates and ppf and blood. Usually better to give the whole blood to the patients, so you get all the factors available in your whole blood, and which helping to decrease the coagulopathy during the cardiopulmonary bypass. And even for the pediatric surgery, most of the patients you are doing the modified ultrafiltration, as I mentioned that you can do the blood conservation techniques. So one of the method is your RAP, retrograde autologous priming. The second is you can do the conventional ultrafiltration, and third is you can do the modified ultrafiltration, which is helping to reduce the crystallide from the and increase your viscosity and increase your concentration of your blood factors and hemoglobin levels. So these are the small steps you have to do. And for managing the level of the fibrinogen level and the rest of the blood factors, you have to coordinate with your anesthetist, with your surgeons. Pre-plan, you have the bypass checklist. Go through with that and do the blood conservations techniques, and keep the fibrinogen level above than a 200 milligram per deciliter. And for that you can check with the help of the tag or with the rotam machines, which is available in operating rooms. And as I mentioned, the fibrinogen is play a key role to keep patients uh, avoid the bleeding. So rotam or a tag machine also helping to do the your APT level or PT level, and the fibrinogen level. So it will tell you which thing is missing. So like sometimes your platelets is dropped, or you required a PPF, or you required a sorry platelets or fibrinogen, or a fresh frozen plasma. So with the help of the tag and with the rotam, you can manage your blood clotting factor during the cardiopulmonary bypass, especially in a pediatric surgery. So hope you get the brief answer of how to manage the cardiopulmonary bypass and manage fibrinogen level during the bypass as a perfusionist. So guys, if you like this video, please share, like, comments, negative, positive, whatever comments. I like everything from your side, and which are going to enhance our motivation level, and we are ready to answer, and we are ready to learn from even you. So keep learning, keep sharing. Have a nice and good day. Bye bye.